More people in the U.S. and here in Utah are waiting for a kidney than any other organ.
Today, we begin our 5-part series, Faces of Transplants. We're highlighting 5 incredible stories that show the precious gift of life.
In part 1 of the sponsor segment with Intermountain Medical Center, News 4 Utah's Jerold Wilcox brings us the importance of being a living donor.
They are the most generous acts we see in medicine. And Jerold Wilcox of Riverton didn't have to look very far to find his superhero just a few doors down. An avid cyclist, 57-year-old Jerold Wilcox was used to grueling uphill battles. But when he found himself losing steam, keeping up with his friends,
and I used to be able to beat him up the hill,
he didn't know he'd be facing his toughest challenge yet.
First words out of the nephrologist's mouth was, "You need a kidney transplant."
As a nurse manager at the NICU in Provo, Jerold spent a career bringing life into the world, and now his was slipping away.
His story is actually a very common one.
Dr. Donald Morris, a transplant nephrologist at Intermountain Medical Center, says that's because Jerold had type 1 diabetes since he was a child.
Living donation is often the best option for someone who needs a kidney transplant if they're fortunate enough, like Jerold, to have someone step forward.
That someone?
I'm just grateful that I could help.
38-year-old Nicole Campbell.
I was just wanting to help. It wasn't something super special.
Jerold would strongly disagree. In his eyes, her act was nothing short of heroic.
Help their life become better is the greatest superhero I could think of. How do you thank someone who is willing to donate an organ to save your life? There are no words. No words whatsoever.
So how did Jerold's neighbor, a stone's throw away, become that superhero?
Good question.
But an easy one to answer for not just Nicole, but his entire neighborhood.
He is the kind of neighbor that when you have a dead tree, he'll come and take care of it. He'll cut it down. He'll be the one that shovels your walk when there's snow. He's the first one there to help.
Jerold received Nicole's kidney 6 months ago this past November.
She and I are connected at the hip, literally, because the kidney's right here.
How lucky? Out of more than 120,000 people in the U.S. waiting for an organ, roughly 100,000 of them are for a kidney.
Every month, 3,000 people are added to the waiting list.
Dr. Moore says patients with diabetes need to be screened annually for chronic kidney disease and watch their diet.
We're quite picky about who we'll let donate so that we feel pretty confident that we can reassure them that they're not going to have long-term health consequences.
Donate an organ either while you're still alive, like a kidney, or sign up, put your name on the list for when you're gone. You don't need those organs. Let someone else have a chance to live.
Jerold is feeling so well these days that he's back to riding his bike again. I'm Saray Chin, News 4 Utah.
Saray, thank you. In part 2, Saray is going to look at liver disease, how it's becoming a crisis, worsening the shortage of liver donations, and how doctors at Intermountain have used creative ways to utilize diseased organs, and it is working.
Time now for Utah's